There's a lot of information out there on sunscreen, and the deluge of facts can sometimes be confusing. Do you really know how much sunscreen you should apply, and what does that SPF number actually mean? Well, here to clear everything up and give us a lesson in Sunscreen 101 is dermatologist Dr. Doris Day. Dr. Day, thanks so much for coming back on the show.
Thanks for having me.
So there is so much information about sunscreen. Let's start out with SPF. So many people are confused about what exactly it means and whether you can that really means the higher SPF you have, the longer you can go without reapplying.
This is such an important question, and let's clear it up once and for all, because I get it every day in my office. So the SPF tells you about UVB protection, the amount of time it takes to burn. So the higher the SPF to a point can make a difference, but beyond a point really doesn't matter. The minimum SPF you should use is an SPF 15, and then probably at the higher limit is SPF 50. And beyond that, it really doesn't make much of a difference. More important than that is to look for broad spectrum protection and to apply enough product and to reapply it often enough in order to get adequate protection. If you're using a 15, you're lucky if you're getting an SPF 70.
Just because we're not putting enough product on, is that right?
Exactly. People don't use enough product. So these are tested in a laboratory, and people don't use in real world that much product because it doesn't look good on the skin. So you're not really getting the SPF that's written on the label.
And what exactly does the number refer to? For instance, SPF 15, does that mean for my skin tone I can go out in the sun and I won't burn for X amount of time?
A simple base formula to know what that SPF really means is, for example, if it takes you 10 minutes to burn without sunscreen and you wear an SPF 15, it's the amount of time to burn times the SPF. That's your new time to burn. So it would be 10 times 15 in that case, which would be 150.
That sounds pretty good.
Minutes, right. So that sounds good, but the problem is that when you increase your SPF, you're really only adding a few minutes. You're not really doubling your time because it doesn't last that long, so you're not really getting that much more protection.
So you're telling us the difference between SPF 15 and SPF 30 is really not that great.
It isn't that great, but the fact that you're not really getting the SPF you think, I think a 15 minimum, if you tend to burn very easily, using an SPF 30 or even up to 50 can be helpful, and I do recommend it if you can tolerate those products. But more importantly is to use enough product and to reapply it often enough. So we can't make that strong enough, is using enough product and reapplying it, because if it's gone, you have zero protection.
Absolutely. And so how often do you recommend to reapply?
Typically every 2 hours, more often if you're swimming or sweating. And also, we now know that UVA is also important, and SPF doesn't tell you anything about UVA. So look for UVA protection. And then there's the word broad spectrum, which has some value because it does mean that it's more stable and it's broader spectrum, but that's not standardized. So you can't know exactly what you're getting, but it's still what we have to look for until the FDA comes out with the new labels.
So you're saying look for something that's at least SPF 15 and that says broad spectrum on the bottle.
Right, and above SPF 50 probably doesn't mean a whole lot.
And above SPF 50, forget about it.
Right, and you can look for these big words like helioplex or mexeril or avotriplex. That is the same thing as looking for broad spectrum or UVA and UVB protection.
All right, and you have some tips on how to do this every day, right? You have a couple of products that you brought us to show us. It's not just about going to the beach and putting on the creams.
Right.
There are other ways to protect
So there
yourself.
are some products. I like the mineral makeup, and there's a few that are in powder form that you can actually, this one by Color Science comes in a brush, and you can actually brush it through and reapply it. So I take this out when I go on walks. I just put it in my bag and I put it on my face, my hands, and my chest.
And powder works just as well as a cream?
If you use enough of it. And this is an SPF 30, and this is another one by Jane Iredale also that is an SPF 30. This one comes with an applicator pad, and you just pat it on. So you can powder your nose, your face, your neck.
And in the powders you say go at least for the SPF 30 because you're probably not putting enough of it on.
Exactly, and because you can. This doesn't clog pores. It goes right on over your makeup. So for women who don't want to reapply their makeup before they go to lunch, this is a great way to powder your nose, takes the edge off any red if you get hot from the sun, and gives you that SPF 30. So I really like these.
And I've always been curious, what about those spray sunscreens? Are they as effective as the creams? Because they seem to be so much lighter.
They are as effective, but I like the continuous spray, not the mist. The continuous spray means as long as you're pressing on that pump, you're getting product. So if you cover adequately, you're getting good coverage. The mist, you really really have to then massage in to make sure you get good coverage. And you know, with the sun, it's not just skin cancer that we worry about. There's lots of immediate things. Women who are on the pill, who go in the sun, can get something called melasma, which happens immediately and can be very uncomfortable. It's a blotchy brown pigmentation, and that tends to be more common in women of color. It's more common in women of men, but in Hispanic women, Asian women, and skin of color, it's more common, and there are treatments for this.
Well, tell us about them, because once the damage is done, Dr. Day, what can we do about it?
So there are treatments. There's a peel that I helped develop that you can go to drdorisday.com to get more information, but the peel is designed to target both the pigmentation and the damage from the sun in a very specific way without actually making you peel. And if you do that towards the beginning of the summer, you can start in a clearer place, and then with proper exposure, proper protection from the exposure, you can actually help keep your skin looking clear and smooth all summer.
So the treatment is both preventative and a treatment to after you've done some damage.
Exactly. And then there's a yeast that can occur called Tinea versicolor that actually this yeast comes out when you sweat and go in the sun, and it makes an enzyme that prevents pigmentation, and that can be treated. It's not contagious, but it doesn't look so good. So proper protection will help prevent that, and then you can treat it as well to help keep your skin looking beautiful.
Oh, Dr. Doris Day, thank you so much. Always a pleasure having you on the show. Such an important topic, sunscreen. Thanks for setting the record straight. And for more sunscreen tips from GMA Health, be sure to check us out on all of our mobile providers.